Now look, I want to tell you a little bit about our sponsors at Northwest Primary Care, because they have this amazing integrated care model that really puts patients front and center, where we deserve to be, okay, obviously. They have clinics in Milwaukee, Happy Valley, Oregon City, and Westland. And the other day, 2 doctors stopped by the studio to really fill us in on the work that they're putting in. Ladies, thank you so much for being here.
Thank you for having us.
So, tell me more about integrated care. What is it?
Integrated care is really a way to bring multiple clinicians and ancillary services together under one roof to really better support our patients in their healthcare journeys.
Wow.
You know, particularly for our patients with chronic disease, they're often seeing multiple providers in multiple locations, and it can be really difficult for them to coordinate all of that and get the care that they need. I'll give you an example, like a patient with diabetes who would be seeing maybe an ophthalmologist for eye exams, along with their primary care physician, a podiatrist for foot care, a clinical pharmacist. Optimally, they'd also be seeing a nutritionist and a health coach. But with all of these providers involved in their care, often what happens is they get overwhelmed and they don't get the care they need. So integrated care is a way to kind of bring these services all together under one roof in one system to really give patients more easy access to these services. And then it's not just for patients with chronic disease. For patients, you know, it's going to be our hub for preventative care services also, things like mammograms and bone density screening and just health education classes. Patients will be able to coordinate scheduling those screening exams, get the health resources all in one location. So we think it's a really great model potentially for what primary could be ongoing.
It sounds amazing. It sounds like it's really just like streamlining things for the patient, and we don't have like 15 million hands and 15 million buckets.
That's exactly right, yes.
Absolutely. What do you think is the biggest benefit for a patient? I mean, I can already imagine so many benefits of just like you describing it, but what do you think is the biggest benefit that patients are going to see from this?
I think the biggest benefit probably is for patients to have a support team that's outside the primary care provider but is communicating directly with the primary care provider. So, you know, we want them to feel supported not only during their office visits but in between visits as well, so that they're not feeling alone in managing their health. They feel like they're part of a team, that we're all working together. You know, for a patient, you know, I might see a patient for diabetes management and prescribe a new medication for them, or talk about using a continuous glucose monitor to help manage their blood sugar. But when they leave the clinic, they go to the pharmacy. What happens when they can't afford their medicine? Or they can't figure out how to get their glucose monitor applied, or they have questions about their diet and how it's affecting their blood sugar management. The integrated care team for us then can step in with our patients and, you know, bring them into the clinic, teach them how to apply the continuous glucose monitor. They can help them navigate financial assistance programs to get the medication more affordably, and then they can meet with a nutritionist to answer questions about diet. So, you know, I think that's a huge benefit. And one other really important wraparound service is that we're offering also some remote patient monitoring, where we have a team that's actually reviewing health measures that patients are sending in, their blood pressure readings, their blood sugar monitoring, their respiratory symptoms, how their breathing is going for a patient with asthma and COPD. And then that team, with close monitoring, we can step in before things really get out of control, which is really helpful for the patients, and again helps them to feel supported in between visits, not just at their visits, so they don't feel like they're just left alone.
Oh my goodness, this is so amazing. And I can say firsthand, I have epilepsy, so I know firsthand like how important it is to feel that support around like your medical team, and it just sounds like you guys are giving that to people, and until you experience it, I don't know if you understand how big of a deal that really is, and how much of a difference that can make in your patient's life. I love that.
Absolutely.
So what is the vision for integrated care?
Yeah, so you're kind of explaining the vision is to support patients, not just the one-on-one interactions with providers, but to give them kind of care that extends beyond those traditional clinic walls, to be more holistic, to be more focused on lifestyle and things that I think we just don't associate with traditional medicine currently. So having access to the nutritionist, the clinical pharmacist to help with medication management, the space is going to be beautiful and provide us with health education classes, including bringing folks in to do nutrition classes and learn how to cook. So kind of supporting health in kind of all its myriads, and not just that like you have a disorder, here's a medication. We're really kind of trying to step out of that box and really treat the whole person, not just the diagnosis, the disorder.
I love that head to toe treatment.
That's right.
Man, so what kind of benefits have your patients already, or have you seen the benefits in your patients already?
Even in the limited time this integrated care model has been in place, we have seen reduced risks of emergency room and hospitalizations. Dr. DeLuca talked about this patient monitoring, and for example, we have folks with congestive heart failure, where one of the symptoms can be fluid buildup on the body, and so they can get swollen legs, shortness of breath with activity or with resting, and so we send out messages twice a week. Patients will report to us their symptoms. Are they better? Are they worse? Or are they about the same? Depending on those answers, our staff is reaching out and calling patients proactively, and we're able to, if things don't seem to be going the way we'd hoped, get them into clinic for same day or next day appointments, make adjustments that are leading to less ER and hospitalizations, which is fantastic, obviously, for both the healthcare system, but for the patients.
It is. Oh my goodness. I love hearing things like this because it just shows how much you are taking care of your patients, and I'm sure they can feel that on the receiving end. I can say from being a patient myself, this whole system just seems amazing. So I have to thank you so much for stopping by so we can get that word out to everyone watching, and just thank you for the work you're doing. I think it's awesome.
Thank you.
Thank you for having us here. We're really excited about it. I think there's an enormous potential for the future too, for expansion. So
I totally agree.
Yeah. We have a beautiful new space opening in Happy Valley. It is November 15th, so we're very excited to move into that and kind of have that be our home base.
I love it. Well, thank you so much. And I know everyone out there is that phone is gonna start ringing off the hook. So y'all get ready.
We'll be ready.
Awesome. Thank you so much.
Thank you.
Oh, they were so awesome. A huge thank you to our sponsors at Northwest Primary Care.